here to do this favor. So I got to know him in order to get good acupuncture. I think a lot of you know that I was really sick with cancer and I had a lot of chemo after effects, which I still have. And in the effort to lessen the pain and get through the toxicity and inflammation, I went to see him. And I've had a fantastically positive result from his treatments. And I think it would be, probably I should be honest and say I had acupuncture in the past, 20, 30 years ago for this and that and the other thing, and I never really responded, or nothing happened. I didn't see any change at all. So it's fair to say that I was pretty skeptical, but it certainly worked for me. So I asked Dr. Mann to come and talk about acupuncture, and I thought we could start by, I'm going to ask him what it is and why it works.
That's a good, kind of loaded question. So hello, welcome everybody. Acupuncture is the insertion of a very fine needle into the body. By doing that, if we look at the old theories that have been around for thousands of years, we're just kind of working with the body's own personal energy. So acupuncture can open up blockages, it can alleviate pain in ways that aren't necessarily explained by the way our mind thinks about those things. And so how that works is whenever you insert a needle into the body, it makes the body send resources to that local area. So we are really good at helping regulate inflammation. So whenever there's things like arthritis, injuries from damaged tissues, we're really good at helping the body to bring down that inflammation in a way that doesn't require side effects besides maybe bruising every once in a while. And then if we're dealing with pain outside of the inflammation points, it helps the body's own natural opioids release. And so there's imaging that has been done on the brain while we're doing acupuncture, and you can see certain parts of the brain fire up. These parts of the brains are responsible for releasing the natural opioids. They're responsible for specific parts of the body that are dealing with pain. So like if your arm has pain, there's specific parts of the brain that are responsible for that are responsible for the function, they're responsible for the nerves. So we can get that part of the brain to fire off with acupuncture needles. So the science is starting to catch up with the understanding of what acupuncture does, even though the observed nature of acupuncture has been well known for thousands of years already. So.
How did you get into acupuncture?
Actually started with the herbal medicine. So I wanted to work with plants to help people heal. And so I started learning herbal medicine. If you want to know the best herbal medicine in the world, the Chinese have the best herbal system. They've had it refined for a long time. And so that was kind of my introduction. And then as I started studying that, there are some things that acupuncture is just amazing for and amazingly quick at fixing that herbal medicine just cannot approach in the rapid time. And so whenever you start to work with those two systems together, you can treat almost everything you see. In China, they have people that are bone setters. So like if you were to go break your leg, you could go to somebody and get that fixed. In America, I would go to the hospital and I would get somebody there at the ER to take care of that broken bone, because those people are not trained here for that kind of stuff. But the whole system is there. So there's the medicine for pregnancy, through birth, all the way through just average life, the things that you deal with until old age, just the things that come with that. There are treatment protocols, like the herbal book that I really kind of stick to is the Mann. That's been around for around 1,800 years.
So that's like a standard book?
It's the
Bible?
It's the Bible of herbal medicine.
So what kind of things Just like colds and sore throats and just general things?
Well, chapter 1 is cold damage, like that's the name of the book, so cold damage. There's a Jingwei part, which is kind of miscellaneous diseases. And so there is a thought, back before we had kind of air-conditioned facilities and access to warm water, cold water, clean food, a lot of your diseases started with getting sick. You didn't have a good environment. So the cold takes a big toll on the body. So if you guys are ever out into the winter and have a light coat or anything like that, and you're stuck out there for a long time with the wind blowing on you, you just tend to get sick often. So then there's the progression of the disease after that. And so as the disease progresses through the body, it goes through the different layers. So we're talking about the Tai Yang, the Yang Ming, the Xiao Yang, then it goes into the yin situations with the Tai Yin, the Xiao Yin, and the Zhuo Yin. And so as that goes in, it goes deeper into the body and it causes more damage to deeper tissue levels. So if you can catch something in the Tai Yang, which is kind of the skin surface layer, and you can expel it, you can heal faster. The longer it goes into the body, the harder that is to get out and the more damage it causes. And then there's you have to use harsher chemicals, stronger treatments to try to help the body recover from the disease.
So do you do this in conjunction with acupuncture?
Definitely.
All the time?
Most of the time. There's a lot of people that don't want to take herbs because they taste horrible. So that's just kind of the nature of that. The flavor is strongly related to the effect that it's going to have on the body. And so if you put it in capsule form or something where you can't taste it, you're kind of losing some of that effect.
So why does the acupuncture work and sometimes not work? Is that up to the receiver or is it the practitioner or both?
I'm going to go on the side of thinking that it's mostly the practitioner not having a good understanding of the approach. And I will admit I've had plenty of patients that I did not have great results with. So it can be patient specific, maybe there's not a good dynamic with the practitioner.
Yeah, so how does that work? I mean, it's not only the placement of the needles, it's what?
It should be the placement of the needles. So if you understand what you're doing, it shouldn't matter the rapport that you have. But if you are going into a situation where you're getting acupuncture, it's somewhat of an intimate environment. You're allowing me to stick needles into your body. That's not something that you allow people to do very often. So that can be a little bit anxious-inducing. And so if your body's not able to relax and kick into that parasympathetic that you need, it may not work as well. And then there's different type of stimulation. So in America, most people are fairly sensitive to needles, so we use a light touch, things like that. I have treated Chinese patients that they feel very upset if I have not made enough stimulation to where they feel some pain. And so that's not going to work for most of my patient base. So there's different types of techniques, there's different understanding. Acupuncture is, it can cover most everything. It's a whole system of medicine that can treat everything. So if I'm not very good at treating, I don't treat pediatrics very often, so I'm not very good at that. So maybe that's just not my specialty. And so maybe other people are like that.
That's interesting. So does anybody have any questions? We can ask questions as we go here, because they don't all have to be my questions. Yes.
What are like some common, so patients come into your office, what are the issues that they are dealing with most commonly?
Some of the most common issue that comes to us is pain. For some reason, people have got the understanding that acupuncture is really good at helping with pain. We have people that are dealing with side effects from opioids. They don't respond well to those types of medications. They don't want to get stuck on those medications. So doctors have started shifting more recently, I'd say in the last 5 or 10 years, to recommending acupuncture as a first line of treatment for people that are dealing with some severe pain. So low back pain, shoulder pain, knee pain, those are things that we're really good with. Tennis elbow, golfer's elbow, things like that. Migraines we're really good with. Some other things that are not really just pain related, digestive issues we're very good at treating digestive issues. Anxiety is a big thing that happens in just treating acupuncture. Like if I'm treating somebody for digestive issues or pain issues, the body just naturally responds to the needles in a way that kind of down regulates your sympathetic. So your fight or flight just kind of calms down. So anxiety is almost like helping anxiety is almost a side effect of getting a treatment. A lot of people are able to take a nap. You'll start to hear digestion kick in after the needles go in, and everybody's always apologizing for that. But it's just, I've done that. I've made that happen. So the body is starting to calm down and it's able to do the things that it's supposed to do. We're really good at treating female issues. There's just chapters and chapters on treating female issues and trying to help the body with that.
So can it work if you don't feel like you're having a response?
What do you mean?
I mean, like sometimes when I've done, I felt like a really change in my energy, and other times I haven't felt so much of a change, but I felt better.
Yeah, and so every treatment is just kind of a little bit different. So you don't have to know that the treatment's happening. It doesn't have to be extremely strong for the body to kind of get the message. And then the more often your body is exposed to acupuncture, it seems to kind of understand what's going on. I have to be careful in that I'm sending a very specific message to the body. If I put too many points in that are just kind of looks like a scattered shot out there. If I can treat it like 1 or 2 issues at a time and get a really clear message and the body knows what I'm trying to do and will respond to that. If I start to treat 4 or 5 issues at a time, the body's just going to be confused and nothing's going to get better.
Another question? Yeah.
So, since we are in a piano festival, pianists unfortunately get injured playing the piano due to stress or technique. So a lot of the things that we deal with sometimes are things like carpal tunnel syndrome, tennis elbow, tendonitis, and sometimes pinched nerves or impingement of nerves. Is acupuncture a good way of treating these things?
Definitely. So I treat a lot of that stuff just throughout my practice, different types of lifestyles.
Orchestra musicians.
Was that?
Orchestra musicians are that.
They do it. So, and just office people. Like there's people that are working on computers all the time. They're kind of in a similar position wise. And so I'm treating carpal tunnel. There's a lot of stuff that starts up here that kind of goes down into the arms. And so if we don't get enough relaxation into these muscles and they start to cramp up, we need to make sure that gets addressed. And stretching is a good way to start that. Just if you start to feel those symptoms coming on, making sure to open your chest out, getting things kind of a little bit more pulled away from the front of the chest is going to help open that up. The stuff with the pinched nerves, we need to get fluid back in there. We need to kind of create a little bit more space for the nerves to function properly. Part of that is relaxing the muscles. Part of that is just disc space. So as we age, the discs just kind of compress, and they're the thing that keeps the space open for the nerves to come through. And so stretching is good for that. There's hydration is very important for that part too. If you start getting dehydrated a lot, they just kind of lose some of that moisture in there. But what we also are able to do is that inflammation that comes along with it, once those nerves get pinched, inflammation starts to go in there. That's kind of that pain response that you're feeling.
Right.
So when we put the needles in, we start to get that inflammation to clear out, because whenever we cause trauma to the body with a needle, the body has to respond. And so it thinks that trauma has happened because of that needle. And so the blood is flowing in there. It has to bring the things to heal a damaged tissue. So all the stem cells, the things that clear out inflammation, the white blood cells, stuff like that, all that comes in, fills the space up, clears out that inflammation as it's going through. And so that's why that inflammation response is so good whenever we stick the needles.
So does that mean like if you have an overuse situation, you know, you go for, I don't know, every situation I'm sure is different, but a group of treatments,
Yeah.
would it go away, or is it something like you have to keep going, you know, for the rest of your life?
That's really dependent on the person and the damage that has been caused. Some people, like if you break your arm and there's just going to be some kind of damage there forever, that's most likely happening. Like maybe not so much of a broken arm, but like say you do a rotator cuff tear, that tissue has damaged and the body's going to have to respond to that. So some people are going to respond well, and those treatments won't take as long. Some people are just going to have chronic pain that you need to manage, and that's really dependent on the person.
So you really can't predict the outcome.
Not always, no. I know what should work and what has worked for me in the past, and so
So like say if somebody has a specific overuse injury, well, it doesn't really matter where, do the needles go in the same place for everybody, or is it very much individualized?
it's very individualized unless you guys have the exact same problem. Then most of those needles are going to be the same. Right? So whenever we're dealing with carpal tunnel, there's very few muscles. I mean, there's a lot of muscles here, but they're very finite. So we can get in here, we can address that. We can start to address the stuff up here. But our focus is going to be here for carpal tunnel. There's not much that's happening over on this side of the body. Like there's, acupuncture is a whole system through the body. So whenever I'm dealing with issues of tendons and muscles, I'm going to use some points down here. So we have master points for the gallbladder 34 is a master point for tendons and ligaments. So I'm going to throw that in. Spleen points are for the muscles, so those just kind of get thrown in. But there's I do a lot of local needling. There's something called distal needling, where we can stick needles in your ankle to try to help treat your wrist. So it's amazing how it works. It's kind of hard for the brain to comprehend, but that's part of that conversation I was having earlier, where the imaging of the brain done while we're needling points kind of shows that correlation of how things work out that way.
That's kind of amazing, because you're not, the patient isn't conscious of that.
No.
It's just happening on an unconscious level.
It is, yeah. So the body's responding, and that's why it works on animals. Like they're not.
Yeah, it probably works better on animals, because they're more open.
Yeah. They don't know what's going on, so they're just along for the ride, and they just hang out and you do your thing, and they feel better afterwards. Yeah. Yes, sir.
I have a question. For some people has hand injuries, so if they have acupuncture treatment, how would you treat them? Like which part of muscle should the needle goes in?
So were you saying some people have hand injuries,
Yeah.
and then where would the needles go?
Yes.
Okay, so I just want to make sure I heard that. So with hand injuries, if we can get a hold of somebody that's just had an injury, that helps. We can speed up the healing process on that. So usually we do something with, like say you just had an injury. We don't always go right into the specific tissue that it was injured, but we do something called surrounded dragging. So we'll do a little circle of needles around that, and that's bringing the body's attention to that. It's bringing better blood flow to there. That's also a situation where we might do some herbal topicals and some herbal internal medicine. So there are specific herbs that are good for helping to heal faster and more clean healing. So we can make that scar tissue not be as severe whenever it happens. Depending on what we're dealing with, if we're dealing with broken bones or a cut, they kind of have different responses on how the body has to handle that. But usually I get fairly close to a hand injury. So like in Rebecca's case, we were doing points on her thumbs. They're not always comfortable. So the nerve endings get closer as we get closer to the tips of their fingers and toes. So the closer we get with the needles out there, the more painful that tends to be.
You know, about, I guess, what year is this? I think about 35 years ago, it was actually several people, as you know, I have really dark circles under my eyes, but more now than usual because I'm tired, but so many people were telling me to get acupuncture, so that would, my circles under my eyes would go away.
Yeah.
So I went to this Chinese acupuncturist who was supposedly, great. And I went, I don't know, for a package of treatment. I mean, quite a lot of treatments. And at the end, it was the same.
Yeah.
So, one question for you is that true that you can get rid of your dark circles under your eyes through acupuncture?
I would probably go on the herbal route with that.
Oh, yeah?
Honestly, yeah.
So what causes it?
So there's an excess of fluid, just dampness going on in there. So you can see it's a little bit more puffy. So we need to get that to kind of resolve. And that's just tired. And so acupuncture is not the best at putting energy into the body. Acupuncture, whenever I stick a needle in, I'm using some of your energy to heal your body. And so that's that yang aspect of the body. I'm using your energy. That's why whenever we're dealing with people that are very frail, I can't use a whole lot of needles. They don't have a lot of resources to work with. So in this type of situation...
So then when you do the pulses,
Mhm.
that is, what does that measure when you take the pulses of somebody?
So the pulses they're kind of measuring just how organs are functioning. So there are 6 positions, there's 3 on each side. So we can tell by how strong they are, what kind of energy we have to work with. And so when we're dealing with the left side, we got the heart is the closest to the wrist, and then on the wrist bone is the liver, and then right below that, closer to the heart, is the kidney. And then on the right side, we have the lung, the spleen and stomach, and another kidney point, but it's not as important as the one on the left side. So I can tell how each organ is functioning. I can tell kind of where the deficiencies are. So I can tell where the stagnation is, and so where things are not kind of flowing through, where there's a bottleneck. And so that kind of helps guide my points. It helps me understand how much energy you have. I can tell if somebody has a cold. I can tell if somebody has infections.
Can you tell if somebody's lying?
I'm not that good. I can tell if they're lying about their health.
That's interesting. Another. This is your chance.
Yes, ma'am.
So this is a bit of a personal question, but my grandpa, my maternal grandpa was a Chinese doctor,
Yeah.
and so my mom's side of the family is very into TCM, and it's like growing up, I've always been very skeptical of it because it seems so violent and a little bit random to me. We grew up kind of in Western culture. But a concept that she brings up very often is the idea of dampness and how it affects, making your body heavier and causes migraine and just the various effects and then preventative methods, etc. And I was just wondering if there is scientific backing to don't leave your hair wet, you're gonna get a migraine, or don't eat cold things when you're on the menstrual cycle, etc. That kind of thing. Is there scientific?
I couldn't source the scientific studies right now.
Okay.
I know that there are. Chinese medicine has a ton of scientific research behind it. A lot of it's done in China. There's some of it done here, but the metadata is out there. You can find it. But what we're dealing with, with the cold hair, that's exposing you to more catching a cold and stuff like that. And so whenever people are on their menstrual cycle, they're just more susceptible to having damage. But if you want to do a study on your own, go out and drink a lot of milk, eat a lot of pizza with cheese, and then see how you feel after that. Because those types of things are the dampness causing components to the world. So if you put a lot of damp food, which milk and cheese and bread, they weigh you down, and they put a lot of dampness in the body. So you can test that out yourself. You'll start to see that your allergies are a little bit worse, things like that. So.
And how does it contribute to a migraine, for example?
So migraine, that's going to be person dependent, honestly. So you're going to have one person that does the same thing that you do to cause this, and they're not going to have the migraine. So migraine is just not good blood flow to the brain. So whenever we have dampness just slows things down.
Why is it called dampness?
Because it's like they have to have an example of it in the world. So if you look at, say, a congee, like a rice soup that is cold, it's very, very thick. It's hard to get through. Like whenever you pick it up, it just holds form. That's dampness. And if it gets a little bit thicker, it'll start to, like if you burn it, it starts to get coagulated, and we start to call that phlegm. So dampness is kind of the thinner of the fluids. Phlegm is a little bit thicker. Sometimes with more heat, it'll start to be like, it'll coagulate. So when somebody gets really sick and they got a lot of phlegm in their chest, it's hard to expel with a cough. Like it's very thick and it holds on to its form. Whenever you first get your cold, that's just dampness, and your nose runs and it's all clear and white, and it just comes out profusely.
Are you familiar with gua sha?
Yeah.
Sometimes when I get gua sha myself, there's like a lot of phlegm that comes out, or like dark fluids.
Like that you expel
Yeah,
out of here?
not orally, but just through the skin.
Oh, okay. All right. So washout is where you use something to scrape the muscles. So we use it often with sports injuries. It's kind of something that we also use whenever somebody's starting to catch a cold. So it kind of releases the surface. Whenever we start to scrape, it's kind of diagnostic in a way that as you scrape certain tissues, it's often used back here. You can use it on any muscle if you got enough muscle to work with. But if there is kind of blood buildup in there that didn't get flushed out from working out real hard, lots of exercise, things like that. So you're going to see those marks kind of like people do with cupping, those purple marks. So what it's doing is it's pulling that blood out of the muscle that didn't get flushed out because either it wasn't hydrated, lots of tissue damage, stuff like that. So the darker that is, the more that you needed that. So some people you do that to, nothing will show up. The skin will get a little bit red because it's been pressed on, but it's not deep dark purple. That deep dark purple means something was in there that needs to get expelled from the body. I rarely wash out somebody to the point where I'm having fluid actually come out of the local tissue. So I'd back off just a little bit and stop right before you get to that point. But yeah, no, it's very good. I like it, I use it, it's great. So, yeah. Any other questions?
I'll let someone else have a chance.
Yes, sir.
I don't know if this is at all possible, but since you have all this experience with joints and tendons and muscles, is there anything that you would recommend, sort of like very kind of like primary care type of approach for people like us that are constantly playing, even from the point of view of herbs or diet or anything that can help us to keep our bodies in shape to do what we do?
Yeah, and so it's kind of the same recommendations you get from a lot of people. You need to watch your diet, you need to have a little bit of
And
exercise.
when you say that, you're just saying like a regular, okay, don't get too much fat, don't get too, or is there anything specifically that you would recommend?
Well, that's the thing, is it's not going to be, like Chinese medicine is very specific to a person.
I
It's
see.
not very specific to a population. So you are not going to have the same type of diet recommendations as you do.
I see.
So your body constitution, how you kind of are in life, is going to dictate what you need to do. So people that are a little bit more phlegmy, they have to watch the cheese and the dairy that they put in their body. People that are thin and frail, they need to add more fat. Like they need to keep some of that moisture into their body so that they don't dry up. So that's a challenge in itself. Acupuncture, just as an overall system for well-being is really good because it helps just to distribute resources that the body already has so that everything starts to move smoothly. So depending on what you're dealing with, kind of depends on how often you want to go. But once a month is a pretty good amount of time between treatments for somebody that's in a healthy situation.
Anybody else? So do you think that acupuncture is something that, is worth for these people that was just exploring, just to stay healthy, or?
It's something that it's easier to get into whenever something pops up if you've already had an experience with it. So we're good at dealing with issues that are not severe and not really, really chronic yet. We can take care of chronic conditions, we do it all the time. But whenever you're starting to experience something minor and it's just popping up, if you can come in, we can correct that usually before it becomes something that is going to put you out of operation for a while. So when you just start to feel that twinge of something and it's not gone in a week, like that's kind of a sign that you need to go get some care done. But it's easier to have that experience if you've just gone and had an acupuncture treatment. Just go check it out once and see what it's like. Find somebody that you feel comfortable with. I think that's a major component to how people have good success, is finding a treatment with somebody that they trust, someone they feel comfortable with, because it's a, kind of an exposure. You're allowing somebody to do something to your body that you don't allow anybody to do to your body. Sticking multiple needles in you it's a new experience. And so,
Did you happen to bring any needles?
I got a few needles. Yeah. If anybody wants to come check it out,
Let's see what they look like. Has anybody ever had acupuncture?
I would love to.
Are we actually getting acupuncture?
I don't know, you have to ask.
Wait, are we actually getting acupuncture?
I don't think the liability is good.
Oh.
But I'll show you guys some needles. I don't know how well you're going to see them from over there.
Come over here and look.
Let's see.
I think they're pretty strong. I mean, small.
That depends. So here's my average needle. It's about an inch long, inch and a half. So, don't hold that, just don't scab yourself. So there's that. And then I have needles that are 6 inches long. And so I say these are only used for this area of the body. So people that are dealing with sciatic pain, the piriformis muscle gets tight, it's deep in there. I need something to get to that.
So does it really loosen the muscles up?
It does. Like, have any of you heard of dry needling? You ever seen trigger point? So whenever you stick a needle in the muscle, it starts to twitch a little bit because it's been holding tight, and whenever you break up that signal for the electrons to hold the muscles together, it'll kind of fire off and then it'll release. So
And then it stays released, or just?
it usually stays released, and so it'll eventually try to come back depending on what type of
So
activity
that's
you
why you
do.
have to do a series, so that the muscle learns, don't do that.
It's not magic. It doesn't work like drugs
But the
do.
body learns this without your head being involved. Is that the long one?
This is the long one. When we pull it out of the tube,
Wow, that's scary.
it kind of is. That's why everybody's face down. So, but yeah, if you guys want to come check it out, you can come look at these.
Yes.
So every time you use a new needle, it's a new needle?
It's a new needle. So I think it was in the 90s, the 1990s, they banned the reuse of needles.
Okay.
So in the past, like way long ago, like needles were hard to come by. Like you had to make needles and you had to sharpen them yourself.
Yeah, that must have been really hard.
So you kind of kept your set of needles. Now I go through quite a few needles a day. I'm not too worried about throwing them away if I don't. If if there's a problem with them. They're very high quality. These are most of mine come from Korea. They do a really good job of making needles. And then, yeah, they're cheap. They're easy to use. Like herbs are expensive, and they're getting more expensive. And so they're kind of a finite resource. I don't look at needles that way. So I don't use herbs if I think I can get the same results with acupuncture.
Did you learn here or did you learn in China?
I learned in Austin, Texas. So there was a school that was started back in the 90s, and most of the professors came from Chengdu, China, which is kind of the heartland of herbal medicine. And so I went to that school because they had such a good herbal program. But in China, if you go, say you go to the hospital in China, you'll go in through the front door, you'll have one wing that is Chinese medicine and one wing that is Western medicine. And you get to choose, usually.
Do you have to be careful sometimes with people that are being treated in Western medicine to not interfere with your herbs?
Herbal, I have to be careful mostly with people that are on blood thinners. So that's a big issue with herbs because we have herbs that also thin the blood, and so that could just make them have an issue where they bleed too much. But otherwise, it's not really that big a problem. Whenever people are dealing with cancer, it's easier to just not do herbs. That way, if something goes wrong, we're not getting blamed for it. Because the doctors, whenever you introduce something outside of what they're doing, they're going to blame somebody else first, and they may not do the proper care to fix it if they think somebody else is there.
Right.
So it's easier just to kind of stay out of their lane for that. But I have tons of recommendations from doctors coming to me. I don't get too much pushback on most things whenever it comes to herbs. Acupuncture is I don't have too many issues where I don't have the opportunity to do acupuncture on people. The people that I have to be wary of are people that whenever they give blood, if they start to pass out, those people have in the past occasionally had the same response from acupuncture.
Oh, I see.
So it's nice to know. They're already laying down, so it's not that big a deal. Yes, ma'am.
Do you do acupuncture on yourself?
Rarely. I have a problem with knowing that the needle's about to go in and then putting the needle in. So I have to be very desperate. So
do you have your own acupuncturist?
I have a colleague, yeah. So I have
You
somebody
make it
that I go
trained?
to, yeah. And then if I'm at home and I need something done, I make my wife stick a needle or two in and tell her exactly where to put it. And so she can help me out with that. But it's you got to be very careful where you stick the needles. There's a lot going on under the skin that you need to be cognizant and make sure you don't hit the wrong blood vessels, watch out for nerves, things like that. So there's a reason it's a 4-year degree. So, yeah. Any other questions? I'll go here to the yes.
This is maybe just a random question, but is cupping very different from acupuncture, or are those kind of in the same family, or do they do the same thing?
Cupping is kind of similar to gua sha, but cupping is one of those techniques that has been used all across the world. So to say that it's just Chinese is, I don't know, I think does a disservice to the other cultures out there. So it's been in Eastern Europe for a long time. It's something that somebody figured out, and it's kind of just been mass knowledge, I think, for a long time. Until recently, we seem to have lost it and then kind of came back to it. It does amazing work. It's very helpful. We use it a lot in Chinese medicine. Some people use it a ton. I don't use it a lot because you have a lot of people using it. Massage therapists use it. You can do it yourself. Your partner can do it. Your friends can do it. So I kind of give people direction on how to do it and let them go home and do it because I can do other stuff that they cannot do at home. So it helps. There's a lot of value in it. It's great for just kind of soft tissue injuries with the muscles. It just relaxes the body a little bit. It feels good. Just kind of like with gua sha, don't do it too much. If you leave it on too long or too strong, you're going to start to get blisters on the skin. And so just be careful with that. If you get they make some silicone cups now that you can just squeeze and they'll do the suction. So you can do that over bony tissues and stuff like that. So it's a nice new addition that they've come out
What does
with.
it do?
So cupping, it's kind of like a reverse massage. So it just sucks up the tissue, and whenever you pull that muscle up, it can kind of separate from the layers below it. So you see it a lot with sports people. What else was it? It's also diagnostic. So like if you see a lot of dark purple spots, you need to do that again
Does it
in a few
release the
days.
muscle? Does it release the tension, or what does it do?
It can't. It's basically a reverse massage. So it's making that muscle move and stretch out. And by stretching it out, it's relaxing. But don't do cupping on your neck where there's big vessels. Yeah, just be careful where you do it. Make sure it's okay. Yeah, because these muscles can get tight. Somebody wants to do it, but you can give yourself a blood clot in the brain. So, yeah, just be careful.
Yeah, that's not good.
You
Yes,
have a
ma'am.
question?
Do you have any handy pressure points that we can press for any common day, everyday? I
Like to,
don't know, congestion or headaches?
Pressure point.
so for congestion, right here beside the nose is one of the best points. So that's BTOM, up large intestine 20. They're right in that same area. So just right on both sides, and that'll kind of help that out. Headaches, this point right here, they also call this the peak point. So it can help with digestion, but it can help with headaches. And then there's something called Sanjiao 5. It's about three fingers above the wrist bone, in between the two bones on the arm, and that helps with migraines, headaches, stuff like that. So. Any other question? Yes, ma'am.
So you said earlier, it sounds, you're using the person's energy. So some people who have low energy,
Yep.
you can really do so much on that person.
Exactly.
That means, does it mean that person will recover slowly compared to the other person who has large amount of energy?
Yeah, and so you kind of see this with babies. So babies are made of magic. They respond really quickly. So if you want to look like you're good at any kind of medicine, treat babies. If you want to look like you're not very good at medicine, you can treat older people. And so the response is slower. So energy levels are lower. Some people, they get overstimulated, they start to get a little bit lightheaded, dizzy, things like that, because we've used too much energy and they don't have much left. So they need to go take a big nap after their treatment, stuff like that. So that's why checking the pulse is really important, to kind of get an understanding of where that body sits, because you can have somebody that looks like they're very robust walk in with a very weak pulse.
So there's no acupuncture that you can boost up the energy.
We can boost it a little bit, but it's not as good as herbs if we really want to do that. So there's a acupuncture point here called stomach 36 or leg 3 mile. And supposedly when you were on a long military march and you couldn't go any further and you were worn out, you would press on this point and it'd give you enough energy to march another 3 miles. Anything else?
Well, I'm gonna come and see you, so I can ask all my leftover questions.
Awesome.
But, yeah, I mean, I think I can't tell. I mean, I don't know, I don't have a real I heard everything you said, but it's still amazing to me that it works so well. Because it's quite different from any kind of massage or chiropractic.
Yeah.
It's even quite different than cranial sacral work, where you really feel an energy shift, dramatic when you stand up. But this is more subtle. It's sort of out of your control.
It is, and it kind of depends on what we're trying to treat. Like whenever I'm treating somebody with stress and anxiety, like I'm trying to put them down and put them to sleep. And some people I can make them take a nap and they'll be out of it, and I walk back in the room and they're surprised. And if that's not what I'm going for, then I don't put as much effort into that. So whenever I'm trying to just open up blockages for pain, things like that, it's may not be as extreme as a response or so noticeable.
Well, my thing is, I think you ought to know about it, and maybe that's the first place to go if you feel like if you have any hand pains or shoulder pains, or I know there are quite a few people here that have some on and off pain that don't want to talk about it because it's better off, you're better off keeping it hidden. And that's really not the way to go for your life, because it's as you get older, I mean, you're gonna have pain. Nobody gets through life without pain, that's for sure.
You don't.
And that's why we're here. So if you don't have anything else and you're pain-free, then that's great.
Enjoy life. Yeah, that's what's best. Like, we're here when you need us, but yeah, when you're young and healthy, enjoy it. But if something's bothering you, don't just push it away, push it down, because it starts to creep on you.
Yeah, and I think painkillers are probably not the way to go, and definitely not surgery.
No, avoid it at all costs. You can always do surgery later. Pain pills start to damage organ function, and so you want to try to keep away from that as much as possible. So.
Okay, well, thank you so much.
You're very welcome.